Over the next few minutes, I want to briefly go over some of the important factors related to West Nile virus, understanding not only what it is, how it's spread, who gets it, some of the common symptoms and factors, that sort of thing. So we'll begin by looking at West Nile virus as an RNA virus. It's on the genetic level and it's spread by infected mosquitoes. They've done tests and found that because of the spread of West Nile virus through infected mosquitoes into human hosts, that the infection has been found in donor organs, blood transfusions, and even breast milk. But since 2003, they've been testing the blood supply to keep that from being passed on through blood transfusions. The incubation period lasts from 2 to 14 days. It's most likely to occur and show the worst symptoms in adults, especially the elderly, although infants and children can also be exposed and get it. They show the symptoms much more readily. So the very young and the very old are at most risk related to West Nile virus as it spreads through infected mosquitoes. We want to talk then just about the various severity levels of this particular virus, and the largest category by far is viremia, and this occurs in about 80% of those who are exposed to infected mosquitoes, and they show no symptoms whatsoever. And that's a good thing. So 80% of those who are infected show no symptoms whatever. A mild case occurs in about 20%, more or less. And in this case, they get West Nile fever. The symptoms are characterized by fever, malaise, lymphadenopathy, headache, rash, nausea, vomiting. The acute stage usually lasts within just a few days, but symptoms may persist beyond that for weeks. And these persistent symptoms that are often experienced include things like muscular weakness, fatigue, problems concentrating, fever, headache. And out of this 20% who get a mild case, 30% of those, of that 20%, will need to be hospitalized. So a smaller percentage of this small percentage will actually need hospitalization. So those who do get a mild case with West Nile fever, they do show the symptoms, but they don't require hospitalization. Less than 1% of those who are infected with West Nile virus get a severe case. And in this instance, unfortunately, severe neurological symptoms occur with meningitis and associated symptoms being the most common in children and young adults. Treatment is supportive during illness and obviously preventive. So once the illness is there, it's supportive treatment, trying to get them through it, but a lot goes into preventive treatment as well in terms of spraying for mosquitoes and encouraging families in areas where it's likely to make sure that there's mosquito repellent when the children or the elderly especially are going to be outside at dawn or dusk when there's the most likely chance of exposure. So once again, in thinking about West Nile virus today, it's an RNA virus spread by infected mosquitoes. The infection has been found in donor organs, blood transfusions, and breast milk, although since 2003, our blood supply has been monitored for this, and therefore that has kept the amount spread that way very low. The incubation period on it is from 2 to 14 days. Those most at risk are the elderly and the very young. Most people who are exposed are at the viremia level. 80% of people are there, no symptoms at all. About 20% get a mild case. There are symptoms here, but 70% of those need no hospitalization, 30% will. The most common symptoms at this stage are things like fever, malaise, headache, nausea, vomiting, weakness, fatigue, these sorts of common symptoms. And then severe cases, less than 1%, leading to very serious neurological symptoms, meningitis, and require hospitalization. If you'd like to know more about this and related things, please click on the link below this video. It'll take you to a website where you'll find an ebook ready for immediate download.